Hello, everyone. My name is Satira Villafane, and this presentation is titled Cybersecurity as a Strategic Business Enabler. Today, I will discuss why cybersecurity is a critical component of PulseLink Health System's overall business strategy and how a 5-year information security plan can support organizational goals, protect patient information, ensure regulatory compliance, and strengthen business resilience. I'll also discuss governance, security architecture, key organizational roles, cybersecurity frameworks, and how effective communication supports cybersecurity decision making. The purpose of this presentation is to demonstrate why cybersecurity is not simply an IT function, but a strategic business function that supports patient safety, regulatory compliance, organizational resilience, revenue protection, and business continuity. As a healthcare organization that relies on telehealth services and electronic health records, PulseLink Health Systems depends heavily on technology. A successful cyber attack could disrupt patient care, expose sensitive medical information, result in HIPAA violations, and damage the organization's reputation. Because of these risks, cybersecurity must be integrated into business planning and executive decision making. Cybersecurity directly supports PulseLink Health System's mission and vision. The mission is to provide secure, reliable, and accessible healthcare services through telehealth and remote patient monitoring. The vision is to be a trusted leader in innovative digital healthcare delivery. Our information security program supports these goals by ensuring the confidentiality, integrity, and availability of patient information. Protecting healthcare data builds trust with patients and providers while maintaining uninterrupted healthcare services. By aligning cybersecurity objectives with organizational goals, PulseLink can continue delivering high-quality healthcare while managing evolving cyber risks. To achieve long-term cybersecurity maturity, PulseLink will implement a 5-year roadmap. During year one, the focus is on building a foundation through risk assessments, governance development, HIPAA compliance reviews, and asset inventories. In year two, the organization will strengthen protection by implementing zero trust architecture, multi-factor authentication, and endpoint detection and response solutions. These foundational efforts establish the security controls necessary to support future growth and risk reduction. Years 3 through 5 focus on advanced security capabilities. Year 3 emphasizes detection through the implementation of a security operations center, SIEM technology, and threat intelligence integration. Year 4 focuses on resilience through business continuity testing, disaster recovery enhancements, and incident response improvements. Year 5 focuses on optimization by incorporating artificial intelligence-based threat detection, compliance automation, and continuous program improvement. This phased approach ensures that security investments are implemented strategically while supporting organizational objectives. The strategic management plan focuses on long-term organizational goals. Key objectives include reducing cyber risk, protecting patient trust, maintaining HIPAA compliance, improving organizational resilience, and supporting healthcare innovation. To measure success, PulseLink will monitor security maturity scores, regulatory compliance status, mean time to detect threats, and mean time to respond to incidents. These metrics provide leadership with visibility into security performance and help guide future investments. The tactical management plan translates strategic goals into actionable initiatives. Key initiatives include vulnerability management, cybersecurity awareness training, third-party risk management, and identity and access management. The primary goals are to reduce phishing susceptibility, improve patch management effectiveness, and strengthen monitoring capabilities. These activities help bridge the gap between executive strategy and day-to-day security operations. The operational management plan focuses on daily security activities. These activities include log monitoring, vulnerability scanning, incident response, user access reviews, and backup validation. Success is measured by the number of vulnerabilities remediated, incidents resolved, and audit findings addressed. These operational controls ensure that the organization remains protected against evolving threats while supporting regulatory compliance. PulseLink faces several significant cybersecurity risks. Cloud service outages, ransomware attacks, insider threats, and natural disasters all have the potential to disrupt healthcare operations and cause financial losses. For example, ransomware remains one of the most significant threats to healthcare organizations because it can prevent access to critical patient information and impact patient care. Understanding these risks enables leadership to make informed decisions regarding resource allocation and security investments. To support the 5-year strategy, PulseLink will implement a modern security architecture. Key components include zero trust network access, multi-factor authentication, identity governance, secure cloud architecture, SIEM technology, endpoint detection and response, data loss prevention, and encryption. These technologies work together to ensure confidentiality, integrity, and availability, which are the core principles of information security. This layered approach helps protect healthcare systems against both external and internal threats. Successful implementation requires participation from multiple organizational stakeholders. Executive leadership includes the board of directors, CEO, CIO, and CISO. These leaders provide governance, funding, and strategic oversight. Operational leadership includes security managers, system administrators, compliance officers, and healthcare operations managers. Additional stakeholders include human resources, legal counsel, clinical staff, and third-party vendors. Cybersecurity is a shared responsibility that requires collaboration across the entire organization. Effective IT governance ensures that cybersecurity efforts align with business objectives. The governance model includes strategic alignment, risk management, resource management, performance measurement, and value delivery. These components help leadership prioritize investments, monitor performance, ensure accountability, and maintain compliance with regulatory requirements. Strong governance transforms cybersecurity from a technical activity to a strategic business function. PulseLink will utilize multiple cybersecurity frameworks to support governance and compliance. The NIST cybersecurity framework provides overall guidance through its identity, protect, detect, respond, and recover functions. NIST SP 800-53 provides detailed security controls. HIPAA ensures healthcare compliance requirements are met. COBIT supports governance and management objectives. And ISO 27001 establishes a comprehensive information security management system. Together, these frameworks provide a structured and comprehensive cybersecurity program. Effective cybersecurity depends on communication. Organizations must identify risks, formulate solutions, implement controls, and communicate findings to stakeholders. Professional communication methods include executive briefings, security dashboards, incident reports, risk assessments, and security awareness training. Different audiences require different levels of information. Executives focus on business impact, while technical teams require detailed implementation guidance. Effective communication improves decision making, strengthens risk management, and enhances organizational security. A successful cybersecurity program requires clear documentation. Policies provide high-level management direction, standards establish mandatory technical requirements, guidelines offer recommended best practices, Procedures provide step-by-step instructions for completing tasks. For example, a policy may require multi-factor authentication. A standard may specify FIDO2 authentication. A guideline may recommend avoiding public Wi-Fi, and a procedure may explain how users enroll in multi-factor authentication. Together, these documents create consistency and accountability across the organization. Cybersecurity enables patient care, HIPAA compliance, revenue protection, brand reputation, business continuity, and digital transformation. Without cybersecurity, healthcare organizations cannot reliably deliver services, protect patient information, or maintain stakeholder trust. Therefore, cybersecurity should be viewed as a business enabler rather than a cost center. Investments in cybersecurity directly support organizational success and long-term sustainability. In conclusion, I recommend that the board approve the 5-year cybersecurity strategy, governance program enhancements, security architecture modernization efforts, workforce training initiatives, and continuous compliance monitoring. Cybersecurity is essential to protecting patients, maintaining trust, supporting business continuity, and enabling post-link health systems to achieve its mission and vision. Thank you for your time and consideration. I welcome any questions regarding the proposed information, security strategy, and roadmap. Thank you.